I'm from Baton Rouge. I grew up here and I went to University High and got a degree in zoology from LSU. And then I went on up to medical school at LSU Medical Center in Shreveport. And while I was up there, I decided, I wanted to do pediatrics. Well, that's kind of not the truth. I've always known since 7th grade I wanted to be a pediatrician. But after you do so many different classes and different subjects, you realize that is really what I wanted to do. I thought I might want to do OB or maybe even orthopedics, but I ended up with pediatrics and I just love it. I love kids. The Baton Rouge Clinic was looking for somebody when I finished my residency, which was also up in Shreveport. And so I came here and interviewed and I loved it and I was very happy that they let me come to work here. When I'm not being a doctor, if I'm not at an LSU sporting event or up until a few years ago playing one myself, I love softball, volleyball is a big favorite. I love to ride horses. I've shown cutting horses in competitions. And I love to travel, I love to read, I'm an avid reader. When I need to escape from being a doctor, I either do something creative, like I love to scrapbook, or I'll read a good romance novel, usually historical romance. The favorite part of my day is being in the room with my patients. Doing all the other paperwork and all can bog you down, or dealing with the insurance companies on the phone. But what I really love is being in there talking to the patient. I usually walk in and I talk to the patient, even if they're babies, and you're doing part of your exam that whole time. You're looking at them. Do they look back at you? Do they smile when they're supposed to smile? Do they respond? A 2-year-old is probably not going to talk to you, but I can always get great stories out of a 3-year-old. And I do love to see my kids grow up. Before I came in here, I did a 13-year-old's physical, and I can remember seeing he and his mom in the hospital as a baby. So it's a big deal. I love my kids. I love being with them. The best thing you can do is be able to talk to your physician. And we in the pediatric world, we actually do free visits for you to come. It's a prenatal visit. You come and get to meet with us. And you can ask us all kind of scientific questions and that sort of deal. But ultimately, you're going to see a lot of that physician in the first 2 years of your child's life, just counting well visits, not counting if you happen to get a cold or an earache in between. And so if you can't have a conversation with that doctor, and if you can't feel that you trust that doctor, then that's not who you need to be going to. If you're going to always question, if you're going to feel that way, there's another person out there. And for me, that's what the Baton Rouge Clinic offers, is because we're all, our goals are the same in child care and medicine. Our presentation is a little different, each one of us, and so I think you could find your pediatrician, if it's not me, but someone here at the Baton Rouge Clinic. The biggest thing, and like for my own practice, I use the rule of, if you use the magic words, "I want to be seen," my nurses, the front desk, everybody knows if you use those magic words, I'm going to see you that day. And by far and large, I'm wide open and available to see you. If for some reason I'm out of town or I do have to leave early that day for some reason, I have 15 wonderful partners, and what I will do is I will make sure that you have an appointment. So a parent can rest easy that they're going to be seen. There's no wait and just go to the urgent care that you don't know about. I'm going to have you seen that day. So that usually is very comforting to parents.